In an emergency, you want a top-notch emergency department nearby. For thousands of people in Martin County, that hasn't been the case for 2 years after Martin General Hospital suddenly closed. ECU Health is leading the charge to reopen the rural hospital. And as WRAL Health reporter Grace Habud reports, this plan comes with a hefty price tag.
ECU Health tells me reopening Martin General Hospital will require an innovative approach combining local, state, and federal officials and thinking in a way no hospital system here in North Carolina has ever done before. But it's a challenge the health system's chief operating officer says they're ready for.
We want to be a national leader in rural health care. We are uniquely designed to be so as an academic health system that operates entirely in a rural community in all of our facilities.
WRAL reported last month ECU Health filed a letter of intent to work with Martin County to reopen Martin General as the state's first rural emergency hospital. It would mean these doors would reopen for emergency care only. Patients requiring longer inpatient stays would be transferred here to ECU Health Beaufort.
We know it's going to take somewhere between $60 to $70 million to build the rural emergency hospital component there in Martin County. And then the bed tower at Beaufort would be the remaining balance.
ECU Health says in total, the request to the General Assembly will be in the neighborhood of $220 million. Hospital execs say the health impacts of this closure on local patients are growing worse, and potential benefits outweigh the immediate financial costs of reestablishing care.
They would come in one of our other hospitals, which are already high-volume emergency departments many times, that do a phenomenal job taking care of patients, but they're not designed for the volume that comes in with the closure of that hospital. We see these patients needing care closer to home.
So what is the likelihood of all of this really happening? We want to bring in WRAL state government reporter Paul Spey now. From a state budget perspective, Paul, what is the likelihood ECU Health really gets all of this money they're asking for?
Well, in this budget, it seems unlikely. We spoke to a state lawmaker today who's involved in the budget talks. Now, to catch you up, state lawmakers are way late on the spending plan that they're putting forward for the next couple years, the next fiscal year. And so that's in action right now. This request from ECU comes in a little late. It's unclear whether or not they'll be able to get $200 million into the next state budget. But the same state lawmaker we spoke to said he's intrigued by this idea. They're trying to get more doctors and more beds into Eastern North Carolina, so they may find a way to do it outside of the budget process, perhaps in its own bill. We'll see.
The answer, maybe.
Maybe.
We'll just have to see. A lot for us to keep our eye on here, and we're going to keep doing it. Right now at home, you can read our in-depth coverage on all things Martin General right now on WRAL.com.